neck or facelift incisions will be, and most people that are considering a facelift seem to be most concerned with exactly where the incisions are and how well they'll be hidden. So I'm going to borrow Raquel here, who needs no facelift. I'm going to show you where the typical facelift incisions would be. So Raquel, turn that way. When we're doing a facelift and neck lift, often where the excess skin will be is under the chin and at the jawline. Turn this way just a little bit. So when we lift, the direction that the muscle layer is lifted is actually straight up. That prevents unnatural looks. When we lift up, there's always bunching in front of the ear, even on a jawline like Raquel's. So I have to take this and I have to taper it out. It's like a dart in fabric. So when I'm cleaning up the jawline, my incision in the front will always end up as high as it takes to taper that out, and it's usually up in the temple hair. I'll show you in a minute exactly how that heals. Through that same incision is where we tighten the muscles of the side of the face to create a nice clean jawline without making it look too tight. In people with a lot of neck looseness, this neck looseness is brought up this direction, but I can't leave pleats like this. I have to take those pleats and work them all the way out and do it in a way that people can still wear their hair up behind their ear and not see any visible incision lines. In doing that, this is where the typical set of incision lines is. First is in the temple hair, and it passes very well for scalp. It's a little bit light, it's got hairs growing through it, and that makes it look an awful lot like scalp because your eye sees that lightness with hair and thinks scalp. From there, it goes into the little curve in front of the ear. You might see it better on this one. And it's exactly at a color and texture change between ear skin and cheek skin. It sits right there, so even though it's in plain sight, it's harder to see. From there, it dives behind the little tab. I'm going to go back to the other ear again. These are close-up pictures of a woman about 6 months after her facelift. Goes behind this little tab, and then into the crease around the earlobe. It's a little bit light, it's a little bit white, but since there are reflections in this general area, your eye perceives that as a reflection rather than an incision line scar. Everything from there is in the crease behind the ear and down again at the hair. So that's how a typical incision heals. That's about 6 months in. The first 3 or 4 months are kind of pink, but they conceal very readily.